Hi everybody, my name is Dr. Philippa Kaye. I am the Ann Summers Resident Sexual Health GP. So we are going to be talking everything cervical screening, from what happens when you get there and at your appointment to what happens if you have a positive test. And the first question is always going to be, where is my cervix? And your cervix is the neck of the womb, and it's that which opens up during contractions in order to allow a baby's head to come out in labour. And it's the neck of the womb, so it's found at the top of the vagina. And if you were to put a finger or two inside yourself, it feels rather like the tip of your nose, and you might actually feel a little dent in it. And that's what your cervix feels like. Now, cervical screening is hugely important because it can prevent a cancer from even happening in the first place, unlike other forms of screening which pick up a cancer when it is already there. So the cells in the cervix, when they become cancerous, they go through a pre-cancerous change first. And it is those changes which have the potential to turn to cancer, but they are not cancer at that point. And it is those changes that are picked up during cervical screening. So the test used to automatically just look for the cell changes, but what happens now is that first it looks for something called HPV. Now, HPV is human papillomavirus, and most of us have been exposed to it at some point in our lives. If you had a wart or a verruca when you were a kid, those are caused by HPV, and there are hundreds and hundreds of types of HPV virus around. But there are certain kinds which are high risk for the development of cervical cancer, and the two highest risk are type 16 and 18. And so when you have your cervical screening, the first thing that the lab looks for is the presence of HPV. If HPV is then found, then they examine the cells of the cervix that have been picked up during the cervical screening process. And if there are changes in those cells, then that will need treatment. So in the first instance, we are looking for HPV. And then if that is there, we will be looking for any changes in the cells. And remember, those changes are pre-cancerous. Cervical screening detects pre-cancerous changes so that we can get treatment to stop cervical cancer happening. Now, the screening program in the UK starts at age 25. In reality, that means that some people will be invited in their 24th year. And then it happens every 3 years, as long as everything is negative, every 3 years between the ages of 25 and 49. And then every 5 years between 50 and 64. And as long as there haven't been any abnormal smear results or any smear changes, then by your 65th birthday, you don't need to have cervical screening anymore. So screening is going to help us prevent a cancer in the first place. And actually, the combination of the HPV vaccination plus cervical screening has the potential to get rid of cervical cancer altogether, which is utterly amazing. Now, you don't have to remember to ring your GP. As long as you are registered with an NHS GP, you will get a letter when you are due to go for screening. And when that letter comes, don't put it in the bin, don't file it away for something that you want to do later. Let's, act on it now because it is so important. And so you ring the GP surgery and you are making an appointment generally with the nurse for cervical screening. And the time of the test is important because ideally we would be having the test when you are not on your period. A little bit of blood isn't going to really interfere with the test, but if you're got a very heavy flow and it's the first day of your period, then that can interfere with the results. So if you know when your period is coming, you want to try and arrange a time for a test when you aren't bleeding. But if your periods are coming all over the place and they're very irregular and you don't know, then just book, because as I said, as long as it's only a little bit of blood, it doesn't interfere with the test. So there we are, appointment made, and the next thing is what happens next.